Oral microbiome. There are 10 bacteria coexisting in our body for each one of our own cells. These microorganisms, which live in symbiosis with our body and form what is called the microbiota, a complex network of communities that contribute significantly to our well-being. The oral cavity is one of the richest districts in our body in terms of variety of species. This is why it is often referred to as the tropical forest of our organism. The bacteria settle in the oral cavity, starting from our birth, and colonize all surfaces of the mouth, tongue, gums, teeth. They persist throughout our life and are closely associated with the state of well-being of the oral cavity. The bacteria exchange information and adapt to the continuous environmental variations that take place in the mouth. This mechanism, called quorum sensing, allows to reach the best possible bacterial concentration. Sometimes, our lifestyle puts at risk the balance of our microflora. Wrong eating habits, excessive use of sugars, for example, tooth loss, orthodontic appliances, the use of drugs such as antibiotics or antidepressants, which cause change in the saliva, head and neck, radiation therapy. All these events can trigger changes in the microflora of the oral cavity, whereby potentially pathogenic bacteria can take over and determine the onset of pathologies such as caries, gingivitis, periodontitis, oral ulcers, and halitosis. In the oral cavity, there are good bacteria that coexist and keep under control the bad bacteria which are potentially pathogenic but are normally inhabitants of the microbiota of the mouth. Periodontitis, gingivitis, oral ulcers, and oral mucositis are inflammatory pathologies of the oral cavity characterized by a greater production of nitric oxide. Halitosis or bad breath, on the other hand, is characterized by a production of volatile sulfur compounds, while caries occurs when the pH of the mouth becomes more acidic. Orabiome, thanks to the L. brevis strain, introduces a considerable amount of enzyme called arginine deaminase, not normally present in your mouth. Thanks to the introduction of this enzyme, the arginine present in the oral cavity is fully metabolized into citrulline and ammonia. The latter, by binding with a hydrogen atom, will determine the production of ammonium, a fundamental substance for maintaining the physiological pH of the oral cavity. The arginine thus metabolized is subtracted from two other metabolic pathways. On the one hand, there will be a lower availability of arginine for the enzyme arginase, with a consequent absence or decrease in the production of ornithine, a fundamental substance for the synthesis of polyamines. Similarly, there will be no nitric oxide synthase enzyme, with consequent lower production of nitric oxide, the most powerful mediator of inflammatory processes. Nitric oxide is also capable of modulating the release of other pro-inflammatory cytokines such as prostaglandins and metalloprotease, thanks to the modulation of the arginine metabolism. Orabiome is able to perform simultaneously three actions: a reduction of inflammatory processes thanks to reduced production of nitric oxide with beneficial effects against gingivitis, periodontitis, and oral ulcers; a reduction in the production of polyamines with consequent beneficial effect on halitosis, and a restoration and maintenance of the normal pH of the mouth with a consequent supportive action in the prevention of caries formation. Orabiome, natural solution for your orodental health. Thank you for your attention.